Okay, got 5:03. Thank you all for being here. Apologize for being a couple minutes late. We'll go ahead and get started. Welcome to the Human Resources Insurance Committee meeting for Tuesday, February the 3rd. Go ahead and call the meeting to order. Jody, if we could do a roll call vote, please.
Mr. Ed Mitchell.
Here.
Ms. Phyllis Crisp. Here. Mr. Gary Farmer. Here. Mr. Mike Lewis.
Here.
Mr. James Brown's absent. Mr. David Merle. Here. Mr. Bill Dunlap. Here. Mr. Mike Kaler. Mr. Tom Stennett. Here. Mr. Grady Caskey. Here. You have a quorum.
Thank you. At this time, we'll take any public input on items that are on the agenda. Seeing none, we'll move on. The minutes for the December 18th meeting should be in your packet. Hopefully you've had time to review those. If so, we'll take a motion to approve those minutes. And a second? Motion and a second. Any discussion on the minutes? If not, all those in favor say aye. Aye. Any opposed? Okay. Item number 4, we have a Courthouse update. Jenny? I'll be happy to.
I think John has actually made his way to the podium, but he will be there to answer any specific questions that you might have. But just to give you an update, we have started the training phase of the Courthouse project. We have had, I believe, approximately 3 web-based training sessions. Excuse me. We have another one tomorrow. We have 2 next week, and the training will then continue from that point on. But if you have any specific questions, John is available. There's not really much more to update other than we're just getting our training at this point. So.
Okay, any questions about Courthouse, where we are in that process?
Yeah, I have some questions, but I'm not sure that I asked.
Well, if you'll ask them, we'll figure it out.
Recent developments have me very concerned about what we're doing here. And when Courthouse was presented to the board of commissioners, most of us were newly elected. The Courthouse deal was something that the previous commission had begun to look at, and heavily upon the recommendation of the executive office, among others, and also right in the middle of an election cycle. When we came on, it was handed to us, and we had to rely on the same basic information. We were handed 160 plus pages. I actually looked at most of it, and I noticed, and we were told that it would save the money save the county a lot of money in the long run. And I looked at the pros and noted that in some of the questions that was asked of Courthouse, that they wanted to know how many employees were in each department and what the schedule for the payroll was. There was never any mention of the necessity for completely changing the way employees were paid. And now apparently we're going to completely change the way that we compensate employees. In fact, I asked if there would be any changes to the payroll schedule, and was told no. Apparently something has either changed or somebody missed something, and the commission and the public needs to know what happened that changed an emphatic no to a definite yes. And that happened within a month's time. I was told at first that the changes were not due to Courthouse. Then I was told that they were due to Courthouse. So I'm not sure what it's due to. I submit questions and they go unanswered. And I think we need to know, why were these changes not brought to the HR committee for complete vetting that would have avoided all of this confusion over it? First question.
Okay. Well, I didn't bring anything to this committee because I'm your HR director and I have no responsibility over payroll. That is under Mr. Vineyard's department, and they did ask my opinion, and I told them on this payroll change that I supported the move to biweekly. I think it's the best business decision for the county, and so that was my input to them when they asked my opinion. But anything further, Mr. Vineyard's here if you'd like to ask him those questions.
But it doesn't answer the question of why it was not brought to this committee. Isn't that what this committee's for?
It's, my personal opinion, I think, Commissioner Caskey, is that the overall decision on the payroll system in general was a part of what this committee does. I don't think this committee is meant to micromanage the HR department or the accounting department of the county, and those decisions, the scope of which were outside of Chronos, are separate decisions in total. So the decision to go to biweekly payroll and the decision to go with Chronos or implement Chronos were two separate matters, in my opinion. Mr. Vineyard, did you want to address any of that?
Well, the reason I didn't bring it to this body, I didn't think that it was under this body's purview. And we've previously spoken about this, Commissioner, and we discussed it again today in the Education Committee, so it's not like we're trying to be anything less than forthcoming. And I think the statement you made can be attributed to me. I was the one that answered the question no. When it was posed, is Chronos requiring this change? Does Chronos require any change in the way we pay people? The answer is still no. They're not requiring that. And any characterization that they are requiring that is unfounded.
Is the Chronos system limited to one payroll schedule?
No, sir. That's the same answer I've given you before. They have no limitations on when we pay people.
Any other questions, Commissioner Caskey?
We were told there would be an additional cost if we didn't make these changes. What cost are we talking about?
Mr. Vineyard?
I don't know what specifically you're referring to, but as I told you earlier, part of the decision-making process to move to a biweekly payroll system was because if there was going to be a change in the way we pay our employees, we needed to do it now because of the data that Chronos was asking for. If we didn't do it now as part of the project, it would require additional resources at a later date. And I'd already made a commitment to commissioners when I discussed the project with them privately that I wouldn't be coming back and asking for more money. I thought $1.4 million was sufficient to integrate our HR and our timekeeping and our payroll systems. And part of this is to allow us to pay people on time and not pay them in advance.
We were also told that the decision to make these changes were made in January after engaging Chronos, and that's what we were told today.
That is correct.
Why didn't we know this before? Why didn't we know this was needed before January?
We've had internal discussions going back as far as August about, are we paying people when we ought to be paying them? Is there any opportunity that we want to improve that and be in a better position to be running more on business principles than what we are right now? We kicked around a couple of implementation timetables. We made the decision to defer that and table it to a later date. And that later date happened after we entered into the contract with Chronos and we started providing them with data for them to get ready to manage the project. Again, it's the same story I've told you before. I'm not going to change the story no matter how many different ways the question gets asked.
I understand. And you know my interest is, my main interest is the school system.
I understand.
And we've discussed that before. The school system employees are not employees of Blount County. employees of Blount County School Board. And we've also talked about how we need to pay in arrears. Well, teachers are already behind. We begin the year behind, and we end up the year behind because we're on a 200-day contract. And we have to wait until the end of July to finish getting paid for the whole year. Now, I know that you had said today that we don't want to include teachers. And I understand that, but that's 850 people. That's just kind of push them to the side. But one of the things that I saw said that our first check for August would be August 17th for a period from, I think it was July the 22nd to August the 8th. Our contract doesn't start till August the 1st. So there's some issue there. I know that there have been a lot of questions about how this was going to be done with the classified employees, hourly workers, about the head custodian that has to go and check an alarm at 2 o'clock in the morning. How are they going to get paid? Those are there's a lot of questions that go unanswered, and before we roll out a system here and totally turn a payroll system up, I was asked what's the downside for teachers. Well, it's $300 a month that we're going to get less every month. That's the downside. That's a pretty big downside. Now, I know that we were told, yeah, you'll make it up in July with your third check, in February with your third check, and again in July. But until February, we're $300 a month behind. And then in February, we start all over, and we're $300 a month behind. And I understand we're trying to address some of the inefficiencies and some of the little quirks in the system as far as hourly workers, but I thought that we were fixing that when we put in time clocks.
Commissioner Casey, this may be an issue, it sounds like this is an issue outside of the Courthouse decision. This is a payroll decision that's been made by the county, which can bear some discussion, but it's not on a part of this agenda for this meeting, and certainly not a part of the Courthouse update. It's related, and if you want to put it on the agenda to talk about at the next meeting, I think that would be appropriate. But I don't know that with where we are now in this agenda that you know, it's just not a part of the agenda or a part of moving this Courthouse piece forward.
Okay.
Any other discussion? Okay, item number 5, open enrollment update. Jenny?
Yeah, thank you. Yeah, so this year, for the plan year for 2015, we had our online enrollment. If you'll remember, we purchased the software this year to do that. It was a passive enrollment, so if our employees did not want to make any changes, they did not have to log into the system to do that. But we did have a slight changes in the number of covered lives for 2015 versus 2014, and just to kind of give you guys an update on some of those numbers. On the medical plan, we increased the total covered bodies by 43. On the dental, it increased 26. The medical spousal surcharge, we actually lost 5 people there, so we went down some on that there. Our health care flexible spending account was decreased by 6 employees there, and then our dependent care flexible spending account, we actually increased and had 5 additional employees enroll in that this year. So that's our update there.
Any questions about any of that information?
Okay.
Okay. Item 7 then, information regarding the state of Tennessee 401k.
How about number 6? Can we do it
6.
first?
Discussion of the wellness program.
Thanks. Yes, so this was, I was asked to put this on the agenda after the meeting that we had, our last scheduled meeting, which I think was back in October. But given the kind of the state of where we are now, that we're, a couple of items down here on the agenda, we're going to be, I'm asking you regarding an RFP regarding an insurance broker. I feel like we need to hold on this before we have any further discussion on wellness plans. This was something that we mentioned in the RFP, that this was an initiative that I would like to do for 2015 if possible. So I feel like we need to wait till our new broker's in place and we can have those conversations with them to discuss what options might be available and how we would like to structure a wellness plan. So I just wanted to give that update because I was asked to have it on the agenda.
And any discussion would be premature at this time without
I believe so, yes.
having made that decision. Any further discussion? Item 7, now information regarding State of Tennessee 401K and 457 deferred comp plans.
Yeah, so at this time, this is information only for you all. Mr. Vineyard had asked that I present this information to you all for your review and that we reconvene as soon as we can to discuss it. This information is in your packet for you to have to review regarding the state 401K and 457 deferred compensation program. So it's something for you all to look over. Feel free to reach out to myself or Mr. Vineyard with some questions about for us to have a discussion on at our next meeting, and we may have to call a meeting to discuss this. I'm not sure how the schedule is going to work out, but I do need you to review this information and you know, be prepared to discuss it in the near future.
Okay, so just for review, and we'll talk about that
Yes.
again probably next time we meet. Item 8, discussion of medical and dental changes, rates, and chiropractic benefits to ACA guidelines.
Yes. So the rates were, at our last scheduled meeting, we had said that we would come back at the January meeting, which we rescheduled to today, with a recommendation for rates. However, given the situation that we present ourselves with, where I'm recommending that we have a new broker, I feel it would be premature to decide on any rates at this point without having their review of our plan and our programs and where we stand there. So I don't think it would be in our best interest to do anything with rates at this time until they've had a chance to review and let me know where we are at that, you know, with that.
Okay, any other discussion on item 8, which is
These rates, are they going to
question.
cover work comp? These rates, will they cover our work comp claims?
Workers' comp is separate. That would be under Mr. Stallion's area, so he would cover that. So this would just be purely on our medical, dental, vision, all of that kind of stuff. And then we do need to have to cover the chiropractic piece separate, but I just want to, if you
Okay.
don't mind, yeah.
Question,
Yeah.
eye coverage. Eye
Vision, okay.
Vision, excuse me. I had someone ask me about that. Apparently in the past, we've sent out cards or something for that?
Not for the vision,
Not for vision?
that I'm aware, no.
Okay,
I think
So
they
s-
can go to their to the website and print a card, but I don't know that they've been mailed.
Lisa.
In regards to Superior Vision, the way that it's set up, when an employee actually enrolls in it, they will get a letter from Superior Vision. At the very bottom of it, it kind of gives them the information of what is covered, like employee family, that type of information, but there's never have been a card.
okay. Well, I'll go back and see if I can remember who it was that asked that question.
But they can have the access to go online under Superior Vision and print out that letter again. That's not a problem.
Thank you.
You're welcome.
Mr. Chairman,
Yes, sir.
prior to Superior, the people who covered us, what was it, Spectra or somewhere, they actually did send out a card, but the current coverage company, we haven't gotten a card.
That may be where the confusion is,
Yeah.
Commissioner Still.
Crowe, somebody in your building.
Thank you, Commissioner Farmer. And chiropractic.
We discussed this on back in our meeting in October, and we had decided that we wouldn't change anything to our chiropractic benefits. However, it was brought back to our attention from our broker that with the ACA guidelines, the way that our current plan is structured, we have a $50 maximum benefit per visit, and then we also have a maximum number of visits per calendar year, and we have to eliminate one of those. So it is my recommendation that we eliminate the $50 maximum benefit per visit, but that we leave the 25 visits per calendar year in place.
Okay, so again, your recommendation is to drop the $50,
Yes, the $50 per visit maximum, but keep the 25 visits per calendar year.
we're going to entertain a motion to accept that. Have a motion, is there a second? Second by Mr. Farmer. Any other discussion? We need a voice vote.
Yes, please.
If you do away with the $50 maximum, what, does that make it unlimited, or what does that do on that?
It just means that the cost per, the cost per visit could increase slightly, but the number of visits will remain the same. So whereas we have the $50 cap now, Jody may have more specifics on what we see on average for the cost per visit. I think most visits are less than about $75. So it shouldn't increase our costs, too much. It would just be a few dollars.
So whereas now we were paying a maximum of
Maximum of
$50. Now if
$50.
it's 75, we'll pay the total 75?
We would pay 80% because our
Okay,
plan is that it's 80% after the
Okay.
employee reaches the deductible.
Okay.
So we would pay 80% of that, and then the employee or the employee or the dependent would have the remainder of that cost.
Any other discussion? Any other questions? Okay.
Decision.
It's a recommendation for this committee to approve.
My recommendation.
So we have a motion to make the recommended change. We have a second. Is there any other discussion?
What do we do if someone starts charging us $150 and our employee wants to go to that doctor?
They need to change.
Do we have a list of people that we accept?
Network, right? We do have a network, so the doctors have to be in the network for our benefit to take place. Otherwise, it's more on the employee side. They would pay more, we would pay less if they're not in the network.
Who makes the decision who's in the network?
Humana. We opt to go with the network that they have established.
So they would help us out in that case.
Mm-hmm. Yeah.
Any other questions? Okay, need a voice vote, please.
Mr. Ed Mitchell?
Yes.
Ms. Phyllis Crisp? Yes. Mr. Gary Farmer? Yes. Mr. Mike Lewis?
Yes.
James Brown? Mr. David Merle? Yes. Mr. Bill Dunlap? Yes. Mr. Mike Kaler? Yes. Mr. Tom Stinnett? Yes. Mr. Grady Caskey? Yes. All in favor?
Motion passes. Item 9, discussion and possible action of RFP regarding our insurance broker.
Yes, thank you. Last time we met, I brought to your attention that I would be submitting an RFP for new broker services for our benefit program. I worked with our purchasing department. We submitted the RFP, and in your packet, you have a memo from Teresa Johnson and Valerie Cunningham from purchasing, letting you know the results of the RFP. You will also see the responses that we received, and then you have a document from the company that I am recommending to you that we choose to proceed, and that is CBiz. They are with us here today too if you have any questions for them, or if you have any questions for anyone in purchasing regarding the process and how that was handled. They are also with us as well.
Jenny, it might be good if you could just kind of go through the process so that everybody will be aware of exactly how this decision was made, or how the recommendation is made.
Sure. As far as the process goes, I'd like to defer that to the purchasing department to let them, because I don't want to leave anything out from a process perspective, and then I can add any of my input, if that's okay.
Yes.
Yes. Excuse me. Thank you. I'm Teresa Johnson, the purchasing agent. And as Jenny was saying, by her request, we issued an RFP back in December, and that is publicly advertised. And then in January, we received those responses and evaluated them. That was narrowed down, and our selection was CBiz, which we had just a verbal interview with to address any other questions that we had and confirm our recommendation, which that is CBiz, our recommendation from the purchasing department, and me as the purchasing agent to award for this RFP. If you have any other questions, I'd be happy to address them for you.
Knowledge of them?
I personally have not had any involvement with them before, but they do have a member on staff, I think, who has worked with the county before. So,
Any other questions, any other discussion? Jenny, if you would also talk about CBiz and kind of the 2 or 3 reasons that your recommendation is in as opposed to others who bid.
sure. So we received 5 bids, I guess you would say, back. And there were some items that we stated in the RFP that must be returned to us. And 3 of those companies did not meet all of those qualifications. They did not submit annual reports to us, so that eliminated them because they did not meet what we had asked, the requirements of the RFP. So that eliminated 3 of them and brought us down to the final 2, which were CBiz and Mercer. And when we went through the evaluation of the 2, Mercer wanted to make some pretty extensive changes to some of our terms and conditions that are standard for the county, and we just felt like that was not appropriate. After reading those and discussing those with purchasing, felt like then, and then based on the interview that we had with CBiz, felt like they were the best fit, best choice.
With CBiz is they will help us with our appeals and grievance process. Mercer was not willing to do that, and that's a large portion. And Jenny and her staff just do not have the manpower to do that. So that was a big plus in their favor. There is no cost to Blount County. The broker will work on a commission.
And that is currently how the current broker operated as well. So the same structure applies to that.
Okay, so your recommendation is that that the county RFP choice is for CBiz. Would entertain that in the form of a motion. Mr. Dunlap, Moves. Second, Mr. Stinnett. Any further discussion? Need a voice vote, please?
Mr. Ed Mitchell? Yes. Ms. Phyllis Crisp? Yes. Mr. Gary Farmer? Yes. Mr. Mike Lewis?
Yes.
Mr. David Merle? Yes. Mr. Bill Dunlap? Yes. Mr. Mike Kaler? Yes. Mr. Tom Stinnett? Yes. Mr. Grady Caskey? Yes. All in favor.
Motion passes. Thank you, Jenny. Okay, that concludes the agenda with the exception of public input on items not on the agenda. And then the only other, pardon? Oh, I'm sorry. Mr. Dunlap?
Is this the appropriate time to get some explanation on why we're increasing, why we have to pay in our work comp again this year? We thought that we had covered that shortfall last year, but got notification the other day that we're going to have to come up with another $68,000 to bring our work comp up to where it's supposed to be this year.
That's Don Stallion's area. He is in the audience, so if he's willing to answer the question and you're okay with that?
Don, can we get you to come up?
Sorry, Don, I need to know.
That's okay.
You're dealing with, but
And I don't mind. I mean, it's a public forum, so we can answer the question. What you're seeing on another surcharge, and you're right, we thought we had addressed, and we did. The good news is we did address the general liability with the surcharge, but the IBNR was not being, which is incurred but not reported, which is kind of how we predict claims that are out there that we don't know about or prepare for the big claim that might come. The methodology that was used to calculate that was underestimating what that IBNR could be, and that is based on what our actuarial service had told us what they thought the IBNR should be. So what you're seeing is a true up in one time of where the IBNR should be. That's the majority of that surcharge. That puts us on firm footing. That makes that takes care of underestimating. We went years underestimating what our IBNR was. So that's where that surcharge comes from.
telling me this is the last year that I'm going to have to dip in and find extra money before the budget's over.
Well, what I can tell you is that numbers are good. Your numbers are good. You know, the mod rate is at 1. For any industry, or countywide, we're under 1. I think we're at 7.75. Any industry in general, that's a good mod rate. When you throw in what you guys do and what the Sheriff's Department does, is an excellent mod rate. So that should work its way through. I can't make any guarantees. I didn't think that this true-up would be as bad as it was. We just sort of picked a year. We've had a couple workers' comp claims that have gone longer than we thought and are becoming more expensive than we thought they were. They're kind of out of our control right now. That affected that IBNR. I would not predict that you would have to do this again, but I cannot guarantee.
Number of employees, does that not have come into play into how much we're paying?
No, what we do is we take our actuarial sends a report back that will tell us what the losses are by department and what the predicted losses are by department, and give us a percentage rate. So we take that percentage rate and apply that to what you pay. So the reason why we pay the actuarial service to do that is so you'll know it's not a number I'm coming up with. It's not a number that we're just thinking makes sense. It's actually a mathematical, pretty accurate number.
Talking about the claims you just mentioned a minute ago, what is the time span on a claim? Is there any set time when we say no more?
We can't. Once we enter into, because of the Tennessee Workers' Compensation Act, the law, we're actually at the mercy of the Department of Labor. We're on general liability. We're more in control. We are, our attorneys are, our claims people are, Tim is, and what goes on. Our hands are really tied when it comes to workers' comp. We have to follow procedures. We have to deny anything. It goes to the Department of Labor, and their attorney gets involved, and our attorney. I don't want to get in a specific case, but we've had one recently where we had an employee get an attorney, go see the attorney's doctor. Of course, it was favorable for them. We had to get an attorney, and then convince their attorney to their, so it is a bureaucratic quagmire at times, but
I can see that, but at some point in time, just kill our losses, do away with our losses, and just say right here's where we're going to stop it, or is that something that the
We
Department
can't.
of Labor has to do for us, or what?
They do, and we can't even go in and say, we want to settle, like we can on a lawsuit. If we look at a lawsuit and say, hey, it's time, we want out of it, we don't have those options as readily available with workers' comp.
Some needs to be looked at on that one. That's a little bit, in my opinion, a little bit ridiculous, Don. I'm not fussing at you.
Oh, no, I agree. I agree with you, but that's, unfortunately, I mean, there's some options there that I'm probably not ready to discuss in a public forum. I think I've discussed with some of y'all. We have some options that we're looking at, but right now, being part of the workers' compensation program in the state of Tennessee, our hands are tied.
Yeah, I'll say as soon as you can get those options up, I'd love to hear them. And I will talk to you though if I hit another $68,000 next year.
All right,
We'll be talking serious.
I understand.
Okay.
Evidently, it's always a moving target, it sounds like, depending on
It is,
what
but I mean,
claims.
and it's just, it's truing some things up, and going forward, I mean, I can't say for sure, but we shouldn't have these issues going forward.
Okay. Thank you, Don. Do you want to recognize Kevin? Okay. I also want to welcome Kevin Prophet with CBiz and Cole Harris. Cole, I'm sorry we haven't met. Anyway, if you took the time to be here, the least we could do is recognize you, see if there was anything you wanted to add to this discussion or about your company, or if you're just happy where you are.
We appreciate the opportunity. Look forward to working with you guys.
Yeah.
We appreciate the opportunity, and we look forward to working with you all on your benefits. I think we can bring a lot to the table, and I appreciate the RFP. It's very in-depth, probably the most in-depth RFP we've looked at before, and I think it's very positive whenever we're looking at it from that perspective, because we are a very unique company and all that we can bring to the table, and I think the RFP allows us to be able to show you all of those pieces to it. So we appreciate the process and look forward to digging in and working with you guys. So, thank you all.
Thank you, Cole. Okay. Any other input from any on the group? If not, entertain a motion to adjourn. Stand adjourned.